If you are pregnant, or if you are planning to get pregnant one day, or if a friend or a family member is pregnant, don't skip this video. This video is for you. Now, if you ever bleed during your pregnancy, don't sit there. Don't expect things to change, because bleeding in pregnancy is an emergency.
What?
Now, you are not menstruating. When you are pregnant, you don't menstruate. When you are pregnant, there's no reason for you to bleed. But then whenever you see blood from your vagina, it means that something is happening inside you. It's either your baby is at risk of dying or something is happening. So for the purpose of this video, I'm going to separate bleeding in pregnancy into bleeding in early pregnancy and bleeding in late pregnancy. Now, when do we say you are bleeding in early pregnancy, and when do you say you are bleeding in late pregnancy? So the cutoff point is 28 weeks. So that's 7 months. Note that there are different causes for each of the scenarios I give. So for bleeding in early pregnancy, it can be as a result of 4 main things. First of all, abortion or miscarriage. The second one is ectopic pregnancy. The third one is a type of pregnancy known as molar pregnancy. And the fourth one is when you have a lesion on your cervix. They call it cervical lesions. Now let's talk about abortion. I know usually when we talk about abortion, people have their own misconceptions about abortion. But abortion is not always you taking medication or you getting rid of the pregnancy yourself. Abortion can be spontaneous or induced. So when it's spontaneous, it means that you don't have any idea. You didn't even know that abortion was okay. You were just there and then you saw blood coming out from your vagina. And then when you went to the hospital to check, they told you that there is no baby inside you again. For induced abortion, that is when you intentionally take something to get rid of the pregnancy. So usually you people have your own way of doing things that sometimes they bust my brain, because some people will go and do, I'm not coming to explain what people do. Sometimes the things we see, I don't want you to go and do them yourself. But then people have their own ways of doing things, taking some medications, grinding some things to take inside. And then you realize that the baby is now forced to come out. That is when we say it's an induced abortion. Now we have types of abortion. The reason why you have to run to the hospital is that we have types of abortion. The first type of abortion is complete abortion. So complete abortion, everything comes out. So the baby, the placenta, the product of conception, everything comes out. For incomplete abortion, part of the product or part of the baby comes out and the rest remain inside you. And you see, the reason why it's dangerous for you to stay at home is that the part that remains inside you will now get rotten, will decompose. And if you don't take care, bacteria will now attack it and now start causing a lot of infections. So you can have infections, it can affect you, you can die from it. It might even cause infertility. Okay, you may not be able to give birth again. So when it happens like that, you have to come to the hospital. So that if part of the baby remains inside you, we will just remove the rest of the product. You get me? Now we also have threatened abortion, where just very small amount of blood comes out, but then the baby is still alive. So we still have to do some things to monitor the baby and keep the baby alive for you. We have inevitable abortion, where part of or some amount of blood comes out, and no matter what you do, the abortion will occur. You cannot prevent the abortion. But you don't know whether it's a complete abortion, or it's an inevitable abortion, or it's an incomplete abortion, or it's a threatened abortion. That's why we have to come. And aside these abortions, when you bleed, what happens is that you become unstable. So we have to give you fluids, we have to give you blood, we have to treat you so that you don't faint or you don't have any issues. Okay, that is abortion. So for ectopic pregnancy to produce blood, it means that the ectopic pregnancy has ruptured. And when it ruptures, you don't have to stay at home, because you are going to bleed. You are going to bleed heavily. And aside bleeding, you become unstable. Okay, and sometimes the product of the ectopic pregnancy can also be retained in you. So you have to come to the hospital so that we give you fluids and blood to stabilize you. And if we will have to remove the rest of the product, we remove them. The third reason is molar pregnancy. Molar pregnancy is when you have abnormal tissues growing in the fetus or in the womb. So those ones, they tend to infiltrate the wall of the womb and cause bleeding. You can see that all these things are very important. Aside the complication, bleeding itself is an emergency, because you can bleed, you can go into shock, and you can die. That's why if you see blood when you are pregnant, you should come to the hospital. Now, the second scenario is bleeding in late pregnancy. So for bleeding in late pregnancy, that one is after 7 months. So the main causes are one, when you have a placenta previa or placenta abruption, or when you have a uterine rupture, or when you have another cervical lesion. So for placental previa, this is when the placenta is abnormally situated. So usually the placenta has a normal position that is supposed to be attached to the uterus. But sometimes the placenta turns upside down, or sometimes it gets positioned at a different place, and so you start bleeding. And this placental previa, if you don't identify it early and treat it, or if you don't identify it early and plan your pregnancy, what happens is that you can go into pregnancy and delivery will be so difficult. So if you see something like this, you have to come. I mean, if after 7 months you find out that you are bleeding, you have to come to the hospital so that we do the necessary investigation to see whether you have placental previa or not, and then we plan your pregnancy. Side that the second one is placenta abruption. This is when the placenta separates from the uterus. So the placenta is the structure that is supposed to provide, it supplies the baby with nutrients and oxygen. Now this placenta has separated from the uterus, so the baby will not survive. Do you understand? So if you delay, what happens is that the baby is going to die, or you are going to have premature delivery, or you yourself, you are going to bleed a lot, or a lot of things can happen. You understand? So it's important that if you see blood after 7 months, you have to come to the hospital. The third reason is when you have a uterine rupture. Uterine rupture means what they're not applying to get them cry. One say yakwalano, and I say yes show. So what I say, your uterus has ruptured. So no matter what you do, you have to fix that uterus, or you have to bring the baby out. So it's an emergency. You have to come to the hospital. So mentioning all these things, by now I'm sure you know that whenever you get pregnant, you should be looking out for these things. The moment you see blood, the moment you bleed, you have to come to the hospital so that we save you and we save your child. Thank you very much. This is Dr. Shades. This is the Vitals. If you find this video useful, just click on the subscribe button and follow me, share, and like. Thank you.